Hi, I'm Elizabeth Ellis, family nurse practitioner with BIS Community Clinic. Given our community is slowly reopening, we wanted to talk with you about BIS Community Clinic operations and how we are currently functioning. Yes, we are open, we are actively seeing patients, and we are open Monday through Friday. We are open Monday through Thursday from 7:30 to 4:30, closed from 12 to 12:30 for lunch, and on Fridays we are open from 7:30 in the morning to 2 p.m. We are scheduling our well patients, non-sick patients, elderly patients first thing in the morning to try and protect them from any potential exposure. And we are scheduling any sick visits in the late afternoons. We're encouraging our parents of children to also continue to schedule and bring your children in for their well child visits and immunizations, as protecting them at this time is very important. Upon arrival to the clinic, we will ask that you call the clinic and let us know that you are here, and a staff member will come out and screen you for your temperature. Pending your temperature, should you have a temperature, then we will take additional precautions and measures, but we will still treat you and see you at the clinic. We also ask that all patients bring a mask, or if you do not have one, we will provide a mask for you, because we will insist that you wear a mask upon entry into the clinic. If you do not have one, we can provide one. But should you refuse to wear a mask, then we will have to reschedule your appointment, or we can schedule a telehealth visit with you at a later time. This precaution is for our patients and for our staff to protect us all from COVID-19 potential exposure. In addition, we ask that only one family member come in with a patient should you require one, or if the patient is a minor, only one parent. We need to limit the number of patients in the clinic to prevent further exposure. We are also asking that you bring in no outside food or drink to protect the staff and yourself. And in addition, we are also asking that you continue your social distancing and your hand washing and or your Purell to your hands at all times. We have marked our waiting room with certain seats that you are allowed to sit on in an effort to provide 6 feet of distance between patients. We're trying to limit only one patient and or family member in the waiting room, and then one patient and or family member in the back being seen during our operational hours. We are also currently testing COVID-19. We do have supplies to do that, but we are only testing those who are potentially sick or having symptoms at this time. We are not just doing random screening. Random screening may be done at the Navasota Grimes County Fairgrounds in Grimes County, or other mass testing sites in Bryan College Station or in Huntsville. We also ask that we have no visitors at this time to protect exposure of unknown patients coming and going in and out of the clinic. We are currently scheduling patients throughout the day, and we are screening all patients over the phone for COVID-19 symptoms. So if you are having any symptoms such as a fever, a headache, diarrhea, sore throat, cold, flu-like symptoms, please let us know. We will see you. We will not turn you away, but we will take additional precautions when we see the patient. Now, to help you, we would like to talk about how to wear masks, since we are requiring masks upon entry into the clinic. And in addition, you should be continuing to wear masks when you are out in public, and continue social distancing and continue your proper hand washing and sanitizing your hands while you are out and getting back to trying to get back to normal. We will, if you do not have one, we will provide you with a mask that looks like this. These are pre-manufactured masks, and they do have a wire at the top of the mask. Before you touch your mask, you should wash your hands thoroughly, or use your hand Purell inside of your vehicle before putting on, or in the clinic before putting on your mask. You will pick up the mask by the ear loops, with the colored side facing out and the white side to your skin and to your face. The wire at the top The pleats will on the outside will go down and the pleats on the inside go up. You will grab each loop carefully, place the mask on your face, the loops over your ears, gently bring the mask down over your chin, underneath your chin, and then gently pinch the wire so that it provides a nice tight fit and is comfortable across the bridge of your nose. Having this down below your chin is very important, and pinching this so it seals the mask as best as possible to provide droplet exposure is very important. Try not to touch your mask at any time while you're wearing it, and before you take the mask off, you want to use your hand sanitizer or wash your hands before taking it off. For those of you who wear earrings, I suggest you do not wear any large earrings because the loops can get caught and that could be painful, and or you might tear your ear trying to get the mask off. Now that you've washed your hands or used hand sanitizer and you want to take your mask off, you're going to use your fingers and grab the loops on either side, pull out, and then over. Then you will place the mask outside down, the part to your face facing up. I also suggest that if you are going multiple places, you're going to be wearing your mask on and off and taking it on and off multiple times, that you have a paper bag in your vehicle and you can store the mask in the paper bag and then grab it out from the ear loops. Try not to grab the mask from the mask itself, only the ear loops. This mask is good for 5 days easily, as long as it does not get wet or very dirty on the inside of the mask. If you see heavy makeup or dust particles, you need to try and change your mask out. For those of you wearing homemade masks, again, the pleats on the outside go down, the pleats on the inside go up, and you use your ear loops to put it on and off. Some people are making masks with a little wire on the inside, and so for those masks, then you can then pinch that closer. If it does not have a wire at the top, that's okay. Having some form of a mask for your protection is better than nothing at all. But continue social distancing, 6 feet apart, groups less than 10 people, and continue your hand washing and your hand Purell sanitizer as much as possible. If you have any questions, feel free to give us a call at the clinic, 936-241-3431. Remember, we are actively open and seeing all patients and accepting new patients. We accept most area insurances. We do accept state Medicaid plans, and we accept veterans insurance. Stay safe out there and enjoy your free time. Thank you, and come see us at BIS Community Clinic.